start. Yay. Then we have about 30 seconds or so. We're gonna just start letting folks in. Come on in. Get ready to share my screen. Hello, hello.
Hello.
I did that backwards, but that's all right. Okay. We will be getting started soon because technology is technology. I have to reload my PowerPoint, but that's all right. I'm glad that you are all here to join us. Hopefully it doesn't take too long to reload. There we go. Now I'm going to do this properly, where I start to share my screen first. And then I can my PowerPoint. In the way. We will see how cooperative technology wants to be with us today. Yay! It's being cooperative. Okay, so as folks come in, any questions that you have, please feel free to put them in the chat. We are, we've got Kat, my awesome assistant, who is going to be making sure I catch those questions. There'll be some that I'm already going to be answering through some of this. So if that's something that comes up, you're like, just kidding, you answered already. That's cool. Just update us. And then feel free to share anything else also. Like if there's any questions you have, if there's any comments you want to make, anything you want to offer, we are here to listen. And yeah, this is just a space for us to learn a little bit about pelvic health, physical therapy for the transgender, gender diverse, non-binary population. I have a disclaimer. I have a few of them. You're going to hear me give you like a few disclaimers as we go through things. One of the big ones is this is truly like basic information. Go back to the first time you might have even heard about the transgender population, and that is the information that you're going to get today. Because sometimes when we're looking at complex, concepts and things like that, we forget about the basics, pronouns, terms, things like that. So that's what we're doing today. So if it's something where you feel like, hey, I know this already, that's cool. Welcome. Thank you. But if it's something that's new to you, please share that as well, because that's what this is all about. We have a couple of people who are still entering and coming in, and that's okay. I like to give people just a couple minutes, but not too much, because I like to talk. And if I keep talking, we're just going to go well over all the time. And I want to respect your time, but also my time too. And so we'll give people a few more minutes. But if you have any questions, comments, anything right now that you would like to share, please feel free. And we will be ready to go in. I'm going to say like 0.2 seconds. Nobody has complained of any issues with logging on, which is great. I haven't seen anything come through. It looks like folks registered, and that is awesome. So if you see me look over to the side a little bit, that's because I have another screen over here that's going to be questions, things, making sure everything's going well. I'm not texting anyone. I'm not. So All right, I think I've babbled just a little bit enough to let people into the room who are late. That's okay. You can pop in any other time. So, welcome, welcome. This is literally Transgender Pelvic Health 101. If you missed my initial introduction, this is truly basic information, just giving you some terms, just some ideas on things for pelvic floor physical therapy within the transgender community. So, let's see how well technology is going to want to work with me. It's going to work great. Okay, so table of contents, right? This is just a little overview of what we're going to look into. 4 kind of big concepts, a little bit of who I am, some terminology, just pronouns, background on trans care, and then some strategies and recommendations for specifically pelvic floor physical therapy. Things that you can do as a patient, but also things like if you are a pelvic floor therapist that you can kind of think about and take into your practice as well. So, again, look at that. Just like I said, a nice little disclaimer. This information truly is not medical advice. I'm not your pelvic floor therapist or your medical provider. So with that, we have to have a little grain of salt with everything that I say. But don't take all of this just at face value. Please do your research. I highly recommend that for anyone that you interact with. But also understand that this is educational, okay? Just to introduce that a little bit to you. And then, so yeah, make sure you talk to your provider about anything you might hear. And at least you won't say, I saw this on TikTok. So there's that. So a little bit about who I am. I am Dr. Sha'Rose Arian. I am a pelvic physiotherapist. And I say physiotherapist versus physical therapist because I have been Australian trained, one in theory by the university that I graduated from, but also in actual practice in Australia on a 2-month long internship in physical therapy, physiotherapy. So the concepts and ideas that I use and I just kind of implore every day are those based off of physiotherapists from really the founders of physical therapy, which is Australia and New Zealand. In general, I am your pelvic ally. So anything and all things around your pelvic floor, I am there for. I am owner of Rose Pelvic Physiotherapy, which is located in Huntsville, Alabama. We have our physical location in downtown Huntsville, but also we do virtual and in-person visits as well. And we're holistic, just as a physiotherapist would be. So I don't only look at the body, what's going on there, but I look at so much more than that. Your sleep, your diet, how your things that you're eating and putting into your body, but also how you're pooping and peeing. All of that goes into the type of person and things that are going on with your body. And then, of course, I am a mom because I decided to do that crazy thing of pregnancy and childbirth and all that stuff. I have 2 little ones, 6 and 3, and I love them. They will not make an appearance tonight because my husband made sure that they would not. I am a bisexual woman and I'm the loved one of a transgender person. So when I speak on some of these topics and things like that, I'm not only speaking from personal experience, I'm speaking on clinical experience, and then of course, education and trainings that I've had as well. So that runs a little bit deep. I have been trained through the APTA on trans pelvic care, but also have taken courses through WPATH and have been a full member of WPATH as well. So things that I'm telling you, it's not just something I saw off TikTok, but it's my life. So let's talk about some terms. Again, like I said, I'm gonna just whittle it down to just the basic terms so that folks can really have a good understanding of what we're talking about and the terms that we're using. Another disclaimer that's not on the screen, but I'm going to share with you is that these are, as of 2024, appropriate terms that I, Dr. Sha'Rose, use in my daily life, in my daily practice. They may not be words or terms that other people are using at this time or that you might see on other platforms. They may not be terms that you agree with, and that's also okay. I love a positive discourse. So if you're like, please tell me why, I would love to hear that as well. But these are terms that in general, most people have heard of and just a little bit more definition on that. So first one being transgender, right? So this is really just a person whose gender does not match the sex that they were born with, right? So sex is, XX, XY, right? Those are the markers in gender, right, that we're giving when we're born. But a transgender person can be abbreviated as trans. That is someone whose their gender does not match the sex that they were born with, right? Think of like gender diverse. So another way, gender diverse, we could say non-binary, we can say gender non-conforming. So these are folks whose gender does not have a defined title, or they don't fall into like the binary, male or female. Okay. Now, when we're looking at things like gender expression, so this is the outward, just outward gender that someone shows to the world through their appearance and their behavior. So if you look at me, I go by she, her pronouns. My gender expression is female. I love my makeup, I love my hair, I love my bright colors. So my gender expression is, you know, as what we would call like traditional female expression. Someone can be transgender or gender diverse, and their gender expression can be completely different from what their, sex might have been and how they identify. So, and if you have any questions on any of these terms, please drop them in the comments. Trans woman, and this again is a term that trans woman, but also can be trans feminine. It can be feminine. There are multiple different terms that can be used, but this is a person who was born male at birth and identifies female. It can be abbreviated MTF, which is male to female. Some people are not comfortable with that terminology anymore, but it's a very general one that we can use right now. And then I'm just going to drop down a little bit to trans man to keep us in the same space. So trans man, which could be trans masculine or masculine, that is a person that's born female but identifies as male, right? So their sex at birth does not match what they're feeling and their chemistry. So this can be abbreviated FTM, so female to male. Then we're gonna pop over to top surgery. Okay, so top surgery can be multiple things, and it can be sometimes just a generalized category, but it can be breast removal or breast tissue removal for any female to male transgender individual or gender diverse person. Or it can be augmentation. So that can be like breast implants for any male to female person. But it also could just be, any type of adjustments that are happening, any procedures also. We're going to go through a bit of those a little bit later. Bottom surgery. Now, we're dropping down just a little bit. Bottom surgery is truly a very wide, open category of surgeries. So that one, it's the reassigning, or it can be the creation, or it can be the removal of anatomy from a person's body. But from transmasculine to transfeminine, that can look a ton of different ways. We're going to talk about some of these surgeries a little bit later. However, we're just scratching the surface of some of the affirming surgeries that can be done, surgeries and procedures that can be done. And then when we look at gender identity, popping up a little bit, that is that's a gender that someone associates with internally. So that is the identity. So when we're asking someone their pronouns, right, how do you identify? What do you associate with internally, right? That can be different from their expression and or how you may see that person physically or appearance wise. So gender identity is how that person associates internally. And then this one is, I save this one for last because this is a very important one. Sexual orientation, right? That is the gender or genders or lack of genders that a person is attracted to. One very important part is that transgender is not a sexual orientation. So, just because someone may be trans feminine, trans masculine, woman, man, that does not mean that they are either attracted to a woman or a man. There's such a wide range of sexual orientations that we have available to us as humans, and which I'm grateful for. So one big thing though is transgender is not a sexual orientation. We cannot just assume someone's preference based off of their outward appearance or even identity. So these are the terms that we're going to be using throughout this remaining of the webinar and then into some of our other ones, and just some general terms for us. Okay, so pronouns. This is huge, okay? Pronouns have all of the importance of how we identify ourselves, but then how we identify with other people. It can be a political thing. We don't have to make it that, but it's important to know like how people might identify. I will tell you, I have 4 pronouns sets here. I might not have all of them. I might be missing some, and that's okay too. But these are the top 4 that, are interacted with on a daily basis. So we're going to go through these, and then I do have a question that came in that I'm going to answer. So most of us know she, her, hers, right? That one is anyone who identifies, not anyone, but someone who has said that they identify in a feminine way or prefer feminine pronouns, she, her, hers. So things like she asked me, her name is, that was hers, right? I know sometimes we have a hard time with how can we implement these pronouns into our language. Then we have they, them, theirs. So this is someone who may not identify with either she or her or he or him, and they prefer the pronoun they or them. Now, we cannot speculate what someone's gender identity is, what their gender expression is, or what their sexual orientation is just based off of their pronouns. So just because someone might go by they, them, they may have a different orientation that we just aren't privy to. So things like they asked me, we asked them, that was theirs, are appropriate ways to implement that into our language. I'm gonna pop down to now this one, they, zai, zed. Okay, this is more of a neutral pronoun, so more it's similar to they, them, and it is one that folks sometimes use. You may not see it as frequently, but it is an appropriate pronoun. And it's they ask me, Zai name, Zai's names is, I might have messed that one up a little bit, and that was Zed. So that one, I think it's just the Z's that are getting me, but being able to implement that into our language can be really affirming for someone who, using their pronouns. And then of course we have he, him, his, right? So he asked me, his name is, and that was his. And honestly, the biggest thing about this, so one of the questions that came in are what are some respectful ways to ask for and use someone's pronouns? That is a huge question because one, you don't want to assume someone's pronoun. Like, I don't know, I do a lot of phone calls. And one of the biggest things that I really hate to do is mispronounce someone's name. So I will get onto YouTube, and if I'm not sure, I'll put someone's name in. And there's so many videos now truly pronouncing some common names, but that may not be, you're not commonly saying. So very important that we identify people properly. So a respectful way to ask someone for their pronouns is to offer your own. That's step one. So things like if you have a pin or a name tag, you can, make sure you put your pronouns on there. Like in the beginning, I didn't offer my pronouns. I didn't say that my pronouns are she, her until we kind of got into things. But from the very beginning, had I put that on the beginning of our webinar, it wouldn't be an assumption that you would have to make. You would just be able to see it. Sometimes it's something that we already can guess, right? Because I might have identified myself as, she's that girl. because I do think I am that girl. But sometimes it's not anything that we can outwardly guess. So a respectful way is to offer your own. Hi, I'm Dr. Sha'Rose. My name is Dr. Sha'Rose, but my pronouns are she, her. Are you comfortable sharing yours with me? That's a great way for you to respectfully ask for someone's pronouns. The other thing is to use someone's pronouns. And if you didn't have that interaction at first, but you want to then use them, you could say, oh my goodness, my pronouns are she, her. I didn't ask you yours. Are you comfortable sharing yours with me? Another way for you to introduce that. The biggest thing with language, pronouns, terms is it doesn't have to be perfect. If you're truly out to be respectful and care for folks, if you admit that you don't know everything, because we don't know everything, and if you admit that you made a mistake in earnest, usually people are very responsive to that. And they're just like, oh, of course, no biggie. My pronouns are they, them. And then you can go about your way. So that's one way for us to be able to be respectful of people, but also not feel like there's so much pressure on us to get it right every time, because we can't get it right every time. But you also, as long as you're not doing it maliciously, people generally understand that. Um, so that is a general idea of terms and language to use within the trans, non-binary, and gender diverse community. If you have any questions, please drop them. I'm loving what we already have been discussing so far. So now we're going to do a little bit of background on trans care. So trans care, when I say this, affirming care. So we have further webinars that we're going to be talking a bit more on for pre-op, so pre-op, post-op, and then some procedures and things in between. But this is a nice little overview of those things to stir up some questions, get some juices flowing, so we can talk about that. Okay, so a little bit on the hormone therapy. This is a question that I get all the time of like, what kind of, hormones can folks be on? Okay, you'll see here that I do have it separated from like female to male, male to female, but also there's arrows going both ways, because the very first thing that we cannot assume is what type of hormone therapy a person may be on. Their outward appearance may not be their internal identity, and or what they're looking for from their body physically from any type of hormone therapy, or what their body may need. So there are cis women and cis men, right? So cis being someone who is born in the same sex and gender that they identify as. But so a cis woman may be taking testosterone to increase her levels, as well as a cis male may be taking estrogen to increase his levels. And that is something that we have to really kind of wrap our heads around, is because hormone therapy exists not only within the trans non-binary community, but it exists just in typical healthcare. And so depending on what someone may have going on, we really can't assume what type of therapy they're on. But that being said, oral testosterone will start on my left. I guess it'll be your left too. Either way, we'll start with oral testosterone. So that is taking testosterone by mouth. Now, I am not here to say one of these methods is more effective or beneficial for someone to take over another, because that truly depends on your body. That depends on, what you're looking for out of hormone replacement therapy. So these are just to introduce us to a little bit of what type of hormones people might have. And we'll dive a little bit more into this in a further webinar. But oral testosterone, so that's taking it by mouth. Subcutaneous testosterone, so that's underneath the skin. Intramuscular, that's going to be within a muscle, usually a big muscle. So think like deltoids, think glute muscles, maybe even thigh muscles. It's usually going to be a big muscle. You don't want to put in a small muscle. That's not going to be comfortable. And then transdermal, so that is on top of the skin. Okay, so think of that as any type of topical testosterone and things like that. And then we move over to the right side. We have anti-androgen. And I say that very carefully because testosterone has so many extra letters in it. And I just feel like some words, I just pull it over to them. But anti-androgen. So that is, we can look at that as like hormone blockers. I have it on the right, that male to female side, that trans feminine side, because I believe that that's where we most hear it. However, it can be used for trans masculine, it can be used for cisgender folks, it can be used across the span, but that is those blockers, right? So typically within the trans feminine population, it's to block that testosterone around puberty or to decrease the effects of puberty. And then we have oral estrogen, which can be taken by mouth, subcutaneous, which is under the skin, and then transdermal, which is on top of the skin. Now there is intermuscular estrogen as well that exists. However, in the U.S., I'm not sure currently how often that is used, but there are different ways that it can be administered. Now, we did have a question that came in, and it was, how does hormone therapy impact pelvic health? That is a wonderful question, okay? Because looking at it, knowing someone's levels is highly important. What what I enjoy doing is looking at folks, their medications that they're on. So when you come in, I know when you go to a doctor, they're like, are you taking any vitamins and any supplements and medications? This is one of those things that is highly important for me and for us to know, because we know some effects that can happen from certain hormones. And we want to make sure that people are in a safe range of it or side effects. So, how it affects your pelvic health is, if we're talking about any type of dryness within the pelvic floor, whether that's within the vaginal canal, it's a little bit different for trans feminine folks, but um, dryness is something that even trans masculine folks have to have concerns with. But if we're talking about healing, so if there's been any surgeries or things like that, topical estrogen has been used for all across the spectrum for folks for healing, just to be able to plump up tissues and improve healing. So that's important if you're noticing that you're not having, so say you had a procedure or say you've had a surgery and the tissue is not healing properly, or if it maybe is past its typical healing phases, then topical estrogen has been used to help with that. Uh, I would say an easy population that we kind of think of is postpartum. So after baby, if there's been any type of tear, we do usually kind of can recommend estrogen, topical estrogen, to help with healing. So that's how it can help, affect the pelvic floor. But also, when we think of any trans masculine folks who may be taking testosterone, things that can happen include like atrophy within the vulva. And so, if someone is having any type of atrophy or any type of narrowing within the vaginal canal, then that's something for us to note as well, because if they're complaining of pain or discomfort, then it may be that they might need to adjust testosterone levels or the type of testosterone that they're using. There's a conversation that needs to happen between the patient and their provider and then their therapist as well. So, pelvic health is huge when we're talking about estrogen, testosterone, or any of the other. No, I did the two major ones, testosterone and estrogen, but progesterone is also a very appropriate hormone that could be a part of a person's affirming care. Okay. So these are types of surgeries. Now, I'm going to go through them just very slightly, vaguely ish. I like I said, with bottom surgery, these do not, like, these just scratch the surface of the different type of bottom surgeries that folks can have, and there's so many different methods of it. I'm going to share a story in a second, but we'll go through these a little bit. I like to talk. I do have them separated again, kind of, trans masculine, trans feminine, but these are also ones that they could cross sometimes. So for our female to male, our trans masculine folks, chest reconstruction or chest masculinization surgery, like that's the typical top surgery that we're talking about. So that is the removal of breast tissue. And sometimes it's actually reconstructing the chest a little bit to give a more masculine appearing chest. Now, I attended I I don't know what it's called, symposium? I don't know. But I attended a live, um, I was able to watch live multiple different types of affirming surgeries through the W Path and in New York. And what I was able to see is that sometimes the top surgery doesn't just look like, we're removing tissue and we're making this more masculine chest, but sometimes it's like we're just removing tissue and there may not even be nipples. They may not want areolas. There's so many different ways that the chest can look, and folks are perfectly okay with it. Sometimes they want some of that concaving, so kind of dipping in effect. Sometimes folks want that. Sometimes folks want more of, the outward kind of pec look. But there's so many different ways that top surgeries can look. And with affirming care and the surgeons, sometimes they can accommodate that. Staying on the left side with the transmasculine folks, we have hysterectomy. So with or without or oophorectomy. Okay, essentially what that is, that's the removal of the uterus with or without the removal of the ovaries. So there are some benefits and some risk to removing ovaries when you do have a hysterectomy. And that is something that folks have to weigh individually. But one benefit to removing the ovaries is that folks have less of a chance of any type of cancers kind of forming. But of course, the benefit of keeping the ovaries is that fertility remains. So not through typical, carrying of the um, fetus itself because the uterus is removed, but through other forms of fertility, folks have that opportunity. And then it also does still keep some hormone balance going because the ovaries are still there. You don't have that with the removal of them. Again, I'm not here to say whether one is better than the other, but those are kind of the things that people have to determine. Do they want biological children or the possibility of biological children when they're looking at removal of ovaries? Or are they okay with kind of removing everything? Um, Metoidoplasty, so that is a form of bottom surgery. That is where the urethra is lengthened and there is a phallus that is created around that phallus being a penis. Um, and it is a somewhat less invasive form of bottom surgery in that phallus. Now, phalloplasty is a little bit more, not a little bit, is more invasive. Phalloplasty looks a lot of different ways. They take donor sites can take donor sites from multiple places. So whether that's the thigh, the arm, the back, there's even some phalloplasties that are being done with skin from the abdomen. Listen, we'll get into that more. Trust me, it's super interesting. But that is a bottom surgery. That's why I said bottom surgery can just be like, I don't know. There's so many possibilities and it's wonderful. So those are a few there. We're gonna move over to trans feminine, so male to female. So these top surgery, right, can look like breast augmentation or feminizing augmentation, mammoplasty. My goodness, extra words. But what that looks like, that could be like breast implants, right? Or that can be reconstructing any current tissue that a person might have into a more feminine appearing chest. So that can look a few different ways as well. Um, and I feel like I definitely missed one on this side. I did. Okay, it's fine. We'll circle back. Um, orchidectomy. which if you see it right across, right, that is the removal of the testicles. So that is something that folks have to make a decision on if they're looking for any type of affirming surgery, whether or not they would want to remove those. Penectomy, of course, removal of the penis. Um, and then we have vaginoplasty, which is the creation of a vaginal canal, and vulva and vaginal canal. So again, that can look many different ways. So there are some folks who may not want a clitoris. There are some folks who may want, a very shallow vaginal canal. Some folks who may want as deep of a canal as possible for their anatomy. So this can look so many different ways. There are some folks who don't even want a vaginal canal. They may want the penectomy and scrotum and things like that removed, but no vaginal canal created. So bottom surgeries can really look many different ways. And then we get into facial and neck feminization. So this one, I think, is one of the most interesting surgeries that I was able to witness. So being able to really change the shape, right, of maybe the chin or even some of the humps that we might have in our forehead, even the nose. That was a really awesome way for folks to be able to affirm themselves. And then, of course, within the neck, like when we think of folks, it may be removal of the Adam's apple or like shaving it down to where it's not as noticeable. Now, one that I did skip on the opposite side was female to male, trans masculine, was lipo and sculpting. So another affirming procedure, sometimes it's not surgery, but procedure can be liposuction of any adipose tissues and then kind of sculpting and creating a more feminine body appearance, things like that. So those are some of the benefits that we have um, to affirming surgeries and procedures. I see there is something in the chat, but I'm not going to pop that open. I'll have Kat let me know what's going on there. But yes, for sure. If you have anything, throw it in the chat, any comments, anything like that, I would love to hear. Let's see. Is technology going to cooperate with me? Yay. Okay. So getting into some strategies and some recommendations. So this is like where pelvic floor physical therapy thrives. Um, okay. This is where pelvic floor physical therapy absolutely thrives. The things that we can do and help folks with. Let's see. There they are. So some of the interventions, right? When we're talking about when is appropriate for someone to seek out pelvic floor therapy, either before or after, during any type of procedures, therapy, things like that. Honestly, the sooner the better. So if you know, right, you're starting this process, whether that's hormone replacement therapy or whether that's any type of procedures or surgeries, go ahead and seek out a pelvic floor physical therapist because there are probably some things already that we naturally do within our body happening. And being able to see where your body is now, get a baseline, and then going forward from it is completely like something that you should be doing. One of the areas that I absolutely love in interventions is manual therapy. So that's hands-on therapy. So that is looking like any type of restrictions, assessing the movement of your tissues, right? Tissues, muscles, things like that. I love working in the abdomen. It is truly my favorite thing. Like, I don't know, taking someone's belly and being able to just like move it around, or you should be able to, is one of my favorite things. But also looking at your bladder. How well does your bladder move, right? If there is a uterus, how well does your uterus move in that area? Are there any tissues and muscles around that are tight or pulling or anything like that? So hands-on manual therapy is a huge space for folks to work on because whether you're starting in the abdomen, back, glutes, hips, there's usually something in there that you can work through. Um, Postural re-education. Okay, listen, because I know currently I'm not in the best posture. I've been sitting at a desk all day. I'm like here. I want to open up. I want to be all types of there. But posture is a big one. When we think about someone adjusting their anatomy or um, changing their anatomy, when we think of increasing tissue on the front of our body, right? So think of like breast augmentations. We're doing some implants, and now you have more weight in the front of your body than you're used to. And one, you may want to show it off. So you're just like out here, right? And now you got a little back pain that you might not have had before because you're arching your back a little bit more because you just want to show things off a little bit. And that's okay. There is an appropriate way to be able to show what you got and preserve your body too. The other thing is if someone is more inclined to kind of covering and decreasing the amount of tissue that they have or wanting to show, they may be more in this closed off position. So learning how to be comfortable, again, maybe after a surgery or after a procedure, to where you can be in a comfortable place, but you're not, closed off here. Dilator protocol, that is usually after um, uh, vaginoplasty. And these dilators that you see here are not the typical ones that you would use for a protocol. There are some, they're more hard plastic type of ones that you usually get from your surgeon. And there are certain protocols. So every surgeon has their own protocol and they have their own way of doing things. I'm not going to say any of them are not appropriate or dumb, but there are some ways that just don't work for everyone. Sometimes protocols are great as a standard, but you got to make it your own. And so sometimes it's taking what that protocol has in place and then what you're able to do physically for yourself and adjust it for your lifestyle. Because even if we look at these dilators down here, the largest diameter, it's pretty large and it's pretty long. And some folks are not wanting to have that wide of a diameter. Okay. Anyway, they don't need that wide of an opening or as long of an opening. So for folks like that, our goal isn't gonna be to get all the way to the largest size um, dilator, even if that is within the protocol. We're gonna get to their desired size and then we're gonna keep them in that space. So for our trans feminine folks, dilator use, if they're not active with penetration, is a lifelong thing, which can be sometimes how we end up with folks who do have to have revisions. But that's a big one. Rib and spinal mobilization. Oh, love it. I love getting on someone's rib cage and just kind of seeing how does it expand or open while they're breathing, and then how does it come in while they're breathing out? Does it move how it's supposed to move? Rib cage and spinal mobility is a huge part of um, honestly affirming care. So when you think of things like binders that help to decrease the breast tissue, that also they're pretty restrictive. So they're decreasing also rib cage mobility. So if you had someone who has been using a binder for a prolonged time, their rib cage mobility may not be very mobile. And so they're needing to learn how to, okay, how do we open things up? How do we get that in an expanded space? That's a huge part of it as well. Star mobilization. I say I find myself saying that I love all of this because I do. I love all of these things. Scar mobility is a huge part of getting back to normal movements and activity. So when you think of the different places and areas that you can have scars, right? We talked about facial, we talked about neck, we've talked about chest, we've talked about stomach, we've talked about bottom surgery. Literally from head to almost toe, there can be a potential for scars when we're looking at any type of affirming surgeries. And so scar mobility is a big part of getting back to normal movement in the sense of like, how well can you lift that arm up after you've had any type of top surgery? How well can you move your face or be able to move your neck and things like that after any type of facial or neck feminization. Those are areas. And so with scar mobility, I always start very simple with desensitization. So think of, taking a finger and rubbing it across the scar, rubbing it above it, rubbing it below it, taking a Q-tip, doing the same thing above, below, and on, and then taking, let's say, a different texture like a washcloth, and then rubbing it on it, above, and below it, right? So desensitization, whoops, I skipped ahead. I'm already, look at me. Desensitization is like the first step before you get to scar mobility, honestly, because sometimes moving that scar and the tissues underneath it is not going to be comfortable. So let's just get the body used to a touch to that area before we start to like do little movements to it. Motor control training, that's just another way of saying coordination, honestly. So does your chest expand and like open when you breathe in, and does it fall down when you breathe out? That's very, at its simplest form, type of motor control training. But also, right, we're talking about bottom surgeries. Are you able to rest down your pelvic floor when you need to, let's say, go to the bathroom? And are you able to contract your pelvic floor when your pelvic floor needs to stop going to the bathroom? That is a big part of it. So things like toileting, things like breathing, coughing, laughing, having the appropriate control to be able to tighten when it needs to tighten and rest when it needs to rest. Myofascial release is, I love it. I love any type of hands-on stuff. I'm a hands-on person. I don't know. I've been using my hands this whole time. I like to talk with my hands. Myofascial release is getting within that muscle and fascia tissue and really helping it to ease, helping it to lay down, helping it to not have those trigger points in it. And that can happen in many places. It can happen at the site or around a surgery or procedure, or it can happen, somewhere else compensating for a surgery or procedure, right? So I think of, if someone has a weaker abdomen, the back is doing a little bit more of the work, but also the glutes might kick in and do some of it too. So you might have these tight spots in the glutes or in the low back that we have to work on and help release, while we're also working on strengthening within the abdomen. Levator ani stretching, so pelvic floor muscles. So that's just that group of pelvic floor muscles within the pelvic floor, the little bowl that we have. And those stretching is huge. Most people are walking around with a tight pelvic floor. It's tight. It may be weak because it's tight, but that stretching, just like taking soft movements, can be the difference of helping to coordinate movements later. Muscle strengthening. Okay, people like to think it's Kegels. It's not Kegels. If you're doing Kegels, I'm not going to tell you to stop doing them, but I'm going to tell you to stop doing them. Okay? Stop doing them inappropriately or at inappropriate times, right? Kegels are not the answer for everything. I'm going to get off my soapbox now. But muscle strengthening isn't just strengthening those pelvic floor muscles, but it's overall strengthening. Okay? So we're strengthening the abdomen, the back, the glutes, all of the system to support everything appropriately, so that when things need to kick on and hold, they can. Biofeedback, that can be through an actual device like the one shown here, or it can be through, honestly, it can be through using a finger. A finger can be biofeedback. Just being able to say, hey, squeeze and tighten around my finger, or open and release around my finger, that is biofeedback. And it can give you a lot of information about what's happening with the pelvic floor. One of the things that I like to do for biofeedback is actually to take a towel roll, and it can be like a hand towel, or it can be like a washcloth, and you roll it up and you put it in the middle of the pelvic floor. So you have someone sit on it. So it's like a towel roll, they're sitting on it, and what it does is it pushes up on your pelvic floor. So there's a little bit of pressure. But what should happen is when you take a breath in, you should feel more pressure on that towel because things are coming in and coming down, right? And then when you take a breath out, things should lift up just a little bit. So less pressure on the towel. That's biofeedback as well. That lets you know how well your pelvic floor may be moving within your normal body functions. And then perineal milking, right? This is something that is specific for phalloplasty. So with that new phallus that is created and the lengthening of the urethra. So the urethra can only be lengthened so long. And then you have this extra tissue that's been created. So there's extra space now that the urine has to go through to get out. So there is a space where you may be teaching someone how to properly milk the perineum to be able to properly get all of the bladder. Well, the bladder is empty, but to get all of that urine through the urethra. And so things like drops, leakage, if you have a trans masculine person that's like, I'm just leaking all the time, that could be part of what's going on is the space now to get from the bladder all the way to the toilet is a little bit longer, but the pressure to do it also isn't completely there. So there's a little bit of leakage that might happen when they feel like they're done. And you have to milk that perineum just a little bit to be able to empty out the urethra completely. So those are some things that pelvic floor can help with. And now this is like just again scratching the surface of where folks really could be getting some help with. Now, of course, if you have any questions or anything, definitely drop those here. I'm going to go into some recommendations. So, as a patient, right, I highly, highly recommend for you to do your research on any pelvic therapist that you have, come in contact with, right? Unless they are, I mean, even still, if they are part of, say, a hospital system that does affirming care, generally they're pretty vetted. They do this all the time. They have some good training, stuff like that. However, if you're in an area that might not be next to a hospital or a hospital therapist, definitely do your research and make sure they have the proper training and understanding. Don't be afraid to try someone else. I understand if someone's not in your area, it can be tough if you're like, I only have one option. See if you can find another one or see if, someone, you can find a referral for someone else. Um, but do your research a little bit because there are folks who offer affirming care but aren't necessarily aware of what that might entail. And that's not anything on their end because maybe they haven't encountered folks. And if they're not being honest about that, that can be a little bit, unsettling for you. So as long as someone is honest and saying, hey, I might not have treated a large volume of people before, but I do know the things that you may need. As long as you're open with communication with me, I'm willing to work with you if you're willing to work with me. That sometimes is completely appropriate. But just make sure that someone's willing to have that conversation. Know and understand your rights for affirming healthcare. That is a big one. Okay. So know the things that you can say yes to, know the things that you can say no to. I'll tell you, you can say no to a lot of things. And you can say yes to a lot of things too. But knowing that you have the right based off of the fact that you're a human being and this is the care that you deserve, you do have the right to say that. Now, of course, we can get political, we can get into all these bills and things that are going on in the world that is just highly ridiculous. So of course you have to work within that realm, but there are so many things within the folks that you work with that you can say, yes and no to. Um, a big thing that I like to recommend for people to please be patient with yourself and your body as things evolve. One of the biggest misconceptions that I found is that when folks start like hormone replacement therapy or if they have a procedure or something, sometimes they feel like immediately they're having these reactions or responses that would take a little bit more time than has passed. So be patient. Be patient with yourself. Be patient with your body. Things are going to change. It will not be forever. It feels like it in that moment, but I promise you, it will not be forever. So it's easier said than done, of course, on this end of things, but give yourself time. And then, of course, use reputable sources when seeking information. Those sources can include WPATH. Okay. That is, I'm not going to pretend like I know the full term of it, but WPATH, WPATH, they actually create the standards of care globally. Okay. That is the world Association for Trans Healthcare. They create the standards of care that any doctor who is doing affirming care should be looking at for recommendations and protocols, surgeons, all of that. So WPATH is a great place. You can find pelvic floor therapists there. I'm on there, and there's actually not a lot of pelvic floor therapists like globally on there, but it is a space where some are. And they have, resources on other providers are. So say you're looking for mental health providers, they vet those folks. Okay. Folks are vetted and you have to apply to be a part of the directory. So that's a very reputable source for finding providers. And then, of course, there are some like the APTA. So there are some courses that they offer, and you can see, of course, the people who offer those courses. So the folks who deliver those courses, they're going to be people who are good resources for you. So making sure you're using reputable sources. Reddit, while it's a great, vast information, it might not be the most reputable place to get your information from. Same thing as like TikTok and Instagram. While I am on Instagram and I'm a reputable source, you gotta take it with a grain of salt. So just pop over to their website and just make sure you're getting some good information. Um, the other thing is, let's talk about some clinician recommendations. So say you are a pelvic floor physical therapist, occupational therapist, or you're a clinician, right? What are some things that I recommend for that? Being aware of a patient's medication use. Like I talked about a little bit with those hormones, there are, estrogen, testosterone. We know that outside of just the what is the word I'm looking for? It's okay. It's getting late. But outside of just the known things that can happen, we have the cardiovascular risk. We have other organs that can be a part of it. So knowing what your patient is, the medications that they're taking and how they might interact with each other is huge. We're not pharmacists. However, we should be able to tell a little bit about what may or may not be appropriate for a person and to be able to refer them back to their pharmacist. Um, Make sure you know and understand appropriate terminology for patients. Like I said earlier, we don't have to have it perfect. We don't have to know all the words that someone uses. I swear to you, I get on social media or I go and I listen to someone and I'm just like, I didn't even know that was a term that we're using anymore or that we're using now. And that's okay. But be willing to continue to learn what may be appropriate. Because let's be real, 10 years ago, there are some words that if we use today, we would be canceled. Um, be prepared to find resources to assist patients with care and treatment. So if that is not you, hop on your Facebook groups that you have or any of the directories you might be a part of and say, hey, I'm needing help with this. Like I have seen folks get great resources and information just by being able to connect with the communities that they have. So if you're not the answer, be willing to find the answer for someone and assist them in that. And then, of course, seek further training in affirming care, right? Like that can be through mentorship, that can be through shadowing. The APTA is great with that. Finding folks who are willing to give you a little bit more understanding of what's going on. So those are some of my recommendations. Before I answer some other questions, I want to first say thank you so much for being here and for listening and asking questions. You can reach out. I do have one thing that I'm going to share with you after I answer some of these questions. But here is my information. You can follow me on Instagram, Your Pelvic Ally. I love sharing resources there. If you have any questions or anything specifically like working with us, anything like that I don't answer in a second, you can email us at info@rosepelvicphysio.com. You can send us a text, but you can also give us a call. And then this is our website here. There was 2 questions that came in. One is, can you share some common misconceptions about trans pelvic health that I encounter? Yeah, so I alluded to that a little bit. One of the things that, the biggest one is that sometimes like atrophy, that is one that I see. Folks and some trans masculine folks will start taking hormone replacement therapy And if they have any pain or any discomfort, the first thing that might come to mind is like atrophy. Oh my goodness, my vaginal canal is narrowing, or my vulva is, shrinking. And that typically takes a little bit of time. It's not going to be as immediate as, you just started hormone replacement therapy and now there's some atrophy that's happening. Usually it takes a little bit of time. There may be something else very, very valid and important happening, but it's not going to be that. Any other misconceptions? So another one is that, again, kind of assuming where someone might fall. So I've definitely had folks come in presenting one way, and lo and behold, they might not have a vaginal canal, and I was not prepared for that. So that is something to definitely be aware of. It's like, don't assume what anatomy someone may or may not have. And if someone's like, I just had surgery, that surgery can be, I mean, we alluded to a little bit of that, like bottom surgery, top surgery. Surgeries can be just wide ranging. Um, and then another question that someone has asked is, how important is mental health support in the overall public health care plan for trans patients? Okay, mental health, well, I did not touch on it here, is huge, right? So this is, when we're talking about pelvic health, for anyone who is familiar with pelvic health, mental health and pelvic health go hand in hand. There's so many things. One book that is kind of like, I don't know, we've all talked about it, is The Body Keeps Score. And that is that connection of what your body and your mind are able to do from, interactions that you've had within your life. And so mental health is a huge part of it. WPATH has, I mean, those mental health providers the list is vast. There's so many. One is because mental health, unfortunately, and I guess fortunately, is almost a barrier to affirming care. So sometimes there are letters that you have to have from one or maybe multiple mental health providers in order to start hormone replacement therapy, or in order to get a certain procedure or a certain surgery. However, it's a big part of it because when we're thinking of someone physically not matching what chemistry and mind are telling them, there is a space there that has to be either reconciled or understood. And mental health therapy is a great way for that to happen. Listen, I got my therapist. I have multiple therapists. I have them as friends. I have them on my payroll because they're amazing in what they do. They're highly needed within our world. And frankly, I don't think they're appreciated enough because they hear and do some wonderful things for people. And frankly, mental health providers are superheroes, if you ask me. So I'm going to stop sharing my screen here, but I do have one other question, and then I'm going to share an offer for y'all. Let's see, what is here? Okay, so the question that came in is, can taking testosterone as a trans masculine person lead to prolapse due to atrophy in the vaginal canal? Okay, let me read that a little bit better for myself. So, can taking testosterone as a trans masculine person lead to prolapse due to the atrophy in the vaginal canal? Okay. What I will say is prolapse is usually created from pressure. So increased pressure. So in short, I don't believe so. I don't believe the connection between atrophy and prolapse. So prolapse is usually where there's maybe a laxity within the structures, and then there may be inappropriate pressure. So let's say constipation or inappropriate pushing type of mechanisms. So it is actually very common. Prolapse is pretty common actually within um, affirming care, and it's something that can be treated. And I've even seen it in one of the surgeries that I was able to watch. Prolapse, it was rectal prolapse that was present, and they just kind of pushed it down and were like, yeah, we'll address that, while we're doing the affirming surgery. But I'm gonna say I'm not sure because I'm also want to make sure that I'm reading it right. Yeah. So that one I'm not 100% sure on, but what I will do for sure is do a little research for you so that I have a more concrete answer. And in our next webinar, which will be pre-op, which will talk a little bit more about bottom, top type surgeries, and excuse me, we won't go into surgeries because we'll go into that a little bit in post-op, but I can have a better answer for that in that time. But I do appreciate you asking that question. If there are no other questions, or while you get those questions together, what I'm going to share with you is that right now, because you attended this webinar, that we are offering a free consultation to you. So that can be on anything for you specifically. So if that's like, I have a question on that, actually, that might be a great way. Just go ahead and schedule a consultation with me, and we can, and Kat's going to drop the link for that in the chat for us. But schedule a consultation and we can actually talk through that a little bit more. Beautiful. Free phone consultation, 15 minutes, and we can talk through it a little bit more. And then, of course, I'll bring it back in another webinar and talk about that a little bit more for you. But that is my thank you to you so that you can have a little bit more information on yourself specifically, or anyone or anything that you have there. I did say that my children were not going to make an appearance tonight, but they might. They might. They just got home. Um, so I again want to thank you all for being here, for giving me your time, giving me your attention, asking the questions, being curious, being in a space where you either are looking for answers or you are wanting to provide answers for someone else. That is very, very important in our world. That free consultation link is there. That is going to be for the next 24 hours. Normally, that consultation is $30. So if you in 24 hours attempt to hit that link, it's going to ask you for your card. I promise you, it will. So if you do have any questions or you want to connect further, definitely use that link and let's have a 15-minute conversation. If you are a clinician, so say you're not a patient, you're a clinician and you're looking for some other, yes, and you're looking for some other information, we do have more webinars that are coming. They are patient-centered, but also good information for you as a clinician. And I am also a certified business coach. So if you're looking for specific mentorship, coaching, and consultation, that is a separate link that I don't believe I had Kat prepared to send for you, but no worries. Just go ahead and send us an email and say, hey, I'm interested in some further information on this, and we can get that over to you. But that is, I'm not going to take up any more of your time because I like to talk. You are absolutely so welcome. Thank you for being here. I love to talk. I'll give you all the information. I cannot wait to bring the rest of this series and the webinars to y'all. And y'all have a good night. Thank you so much.